Hey guys, thanks for tuning back in. So yesterday I did a video on a couple videos and shared my experience on my son's tongue tie and upper lip tie and how it affected him and functionally and what we did about it. I also talked about how I did therapy with him, feeding therapy and speech therapy with him. He also had low muscle tone in addition to the ties and some sensory sensitivity. So I wanted to show you one of the tools that I used with him during the therapy sessions that we did at home. The tool is called the Buzz Buddy. So I'm going to show you. So this is the Buzz Buddy. This is one of the things that I used with my son. I bought it in 2022. So a few years ago, I found out it's actually available on the TikTok shop now. If you think this is helpful, you can find it there. So what I'm going to do is I'm just going to tell you what each one is used for and the ones that I use with my son. But actually you only have to put in one AAA battery for it to work, which is cool. And it has different speeds for the vibration. So I'll put these tips on or talk about these tips after, but you put one of the tips on, whichever one you need, and you push the button. And it has different vibration settings. This is the lowest. It shows you green, so that's how you know it's on the lowest vibration. Then if you want a high speed vibration, it's blue. And then if you want like a pulsing vibration, it just depends on what you're using, what you're targeting, what you're using, and also what the child, that's the pulsing. So it just depends on what you're using it for and also what the child can tolerate. My son never liked the pulsing, so we didn't use him. We usually used the green, the low vibration for him. Okay, so I put the shade down just in case it's easier for you guys to see this, but this is green one is called the Texture Barrel Tip. This one's really good. We use this with him for stimulating his mouth and his cheeks. So you can do the entire mouth and the cheeks specifically and the tongue. So that's inside the mouth. That was helpful for him to stimulate, especially with the low muscle tone. And you can also practice chewing mostly with the back molars. He didn't have teeth for that yet, so we didn't use that for that. We used it for stimulation. And then we also used this one. I guess I don't have to put everyone on, but we also used this one. It's called the Ridged Roller Tip, and this one was really good for him because of the low muscle tone. So we turned it on. Again, he usually had the green one, and we roll it around his cheeks. He liked the first setting, the green one. So you can roll this on the cheeks, on the outside, and you can do it on the lips. And then you can do it rolling it down the tongue as well. And you can do it on the inside of the cheeks, and you can practice lip closure with it and sucking action. So those are all also good for feeding. The stimulation of the cheeks and tongue and everything is all also good for speech production. So those are two of the ones we used. I'm going to show you a couple more. Okay, so before I show you the two that we used the most, I would say as he advanced. So I used this before he had his upper lip and tongue release surgery, and I used it after for feeding because he still needed help. He still needed therapy after the release surgeries to get him up to speed with eating. Lucky that, or blessed that I'm also a feeding therapist, so I knew, what to do. So we did it at home. This is the bear, called the Happy Bear Tip, and you can use it just to introduce the child because it's cute. It's a bear. You can try to just use it to introduce them to the tool because sometimes they get, they don't know what it is and it's just different and it's a funny feeling. So if you do something cute with the bear, oh, look, this is Mr. Happy Bear, whatever. And then you can even have them like touch it at first on their hands, so they were not like shocking them in their face. That's a really good thing to do. So touching, putting on their fingers or wherever they want to put it on their body to get used to the feeling before you start using it for therapy. It's just a good introduction, and they might be more prone to allowing you to use it on their face if they know what it feels like in advance. So the last two that I'm going to show you are ones that we used a lot. This one is called the soft edge tip, and it's used to stimulate or target smaller areas of the mouth. And you can practice biting and chewing, which he needed a lot of practice on because he wasn't used to chewing and biting, even though he should have been at that age because of his tongue and lip tie. They prevented him from, advancing to textures where he had to chew. So we had to practice this a lot. You can also stimulate the lips with this or in the corners of the mouth if you have that like low muscle tone like he also had. So it's good for that as well. And this one is my favorite. It's the textured spoon tip. And we use this a lot. I'll try to see if I have any videos of him using it. We use this with feeding. So initially, we had some purees. I did this before and after his release surgery. So we started with puree because that's all he could really eat before his surgery, before his release of tongue and lip tie. It stimulates the tongue and the gums and the lips during feeding or when you're eating. And it also promotes like texture acceptance. So I said, for him, we had a little bit of low muscle tone. We had the ties and then some textures he kind of avoided. So this is textured. It says bumps on it and then it's vibrating. So you can try it without the vibration first because it does have those bumps and then do the vibration. Just getting them to accept different textures. So you can do this. It doesn't have to be things that my son was dealing with. You could do it on anyone for texture sensitivities, someone who, an autistic child, if they let you, it just depends, or just any other child that has texture aversions or sensitivities with feeding. The other thing we used this for was practicing upper lip movement, removal of food. That was really important for him because he had that significant upper lip tie. So we really needed to work on that. So I loved this for him. It also comes with this little manual and it's pretty cool. It tells you how to operate it. It tells you what the names of the different tips are. It tells you how to clean it. And it comes with a really cool travel case, which I liked because if we went anywhere to a friend's house or and ate, I could take it with us. Or if we traveled far to see my parents, they were far away, so we could take it with us there, and everything was in this nice compartment. And I still have everything in here, so it's a really durable case. So the only video I could find was me holding it. But we use this and the flat spoon. I just wanted you guys to see that we really used it. I'm not just trying to sell it. It's actually a very good product. Okay, bye guys.